it and move on. If you look at the document, this document, I think you don't need to adopt the front page, but it's a beautiful front page with the Victoria Falls. I quite like it myself, and those who went round with us yesterday, I'm sure you enjoyed yourselves as well. The next page and the contents, and you notice those nice photographs. I hope you can identify yourself, heads of delegations, on that photograph with the President of Zimbabwe. And now we go straight to the substance of the report. So let's look at the opening of the meeting, which is paragraphs 1 to 19. And I want us to take that as one chunk. Any comments from ministers and heads of delegation, pages 1 to 19, which is essentially the opening ceremony? Senegal, I see you've put up.
Merci beaucoup, Monsieur le Président. J'avais juste deux remarques. La première, c'est au niveau de la page 9. Au niveau de la page 9.
Senegal, it's easier if you tell us what paragraph, because pages may vary with the various languages. So what paragraph is it?
Ah, les pages sont différentes. Alors, c'est le paragraphe qui porte sur le rapport du comité de vérification des pouvoirs. Le numéro 23.
Thank you, Senegal. Can I just interrupt you a bit?
Non, non. Donc le numéro 4. Au numéro 4. Au numéro 4.
4.
Voilà. Peut-être pour harmoniser, il n'y a que la photo qui manque ici. Pour les autres intervenants à la cérémonie d'ouverture, il y a une photo, mais ici, il n'y a pas de photo.
Thank you, Senegal. A very good observation. Secretariat, can we please install the photograph of Her Excellency Amira El Fadil, our Africa Union Commissioner? Thank you. Thank you, Senegal. Any other observation? Between pages paragraphs 1 and 19. If not, shall we go? Do I need to do? No. Paragraphs 20 is already done. We've already done that. So we move to paragraph 21. Any comments on paragraph 21? If none, we move to paragraph 22 to 24. Paragraphs 22 to 24. You will notice there we'll ask the Secretariat to change the name of the minister there to the name of the Permanent Secretary as having chaired that committee, Shanaz. And also just note that we have also added Chad from today's report. So on paragraph 24, instead of 41 member states, it's now 42 member states. And clearly, therefore, it means only 5 member states did not participate rather than the 6 that is put in there. So we'll ask Secretary to adjust those figures. Any other observation? If none, I'll go to paragraphs 25 to paragraphs 30. In fact, paragraphs 25 to 29, actually. 25 to 29. essentially the biennial report of the regional director, and we've divided it there. If no comments on that, yes, could you put up your flag so we see Burkina Faso?
Merci, Monsieur le Président. Le numéro 26. Dans la version française, il y a un que qui manque. La directrice régionale a aussi mentionné le programme, c'est que le programme. La version française. Okay.
Noted, and I suggest that any other typo errors, please just put it down and we hand it over to the Secretariat. Paragraphs 30 to 35, which is still part of the Regional Director's report. And this is divided into category 1, 2, 3, 4, 5, and 6. And observations on those pages, on those paragraphs? If none, can we go to paragraph 36 to 42, which is still really the RD's report. If there are no observations, we proceed to paragraph 43, which I think you should look on its own. Just that paragraph. Any observations on that paragraph? If none, we go to paragraphs 44 to paragraph 46, which is essentially the International Health Regulations review of the draft 5-year strategic plan. Sorry?
DRC.
Which one?
Congo, DRC.
Congo, DRC. You have the floor.
Merci, Monsieur le Président. Paragraphe 44, la deuxième phrase. Nous pensons que c'est une question de traduction, parce qu'il nous semble important de respecter la sémantique. Les documents originaux parlent de 12 principes fondamentaux, alors qu'ici, la deuxième phrase du même paragraphe 44 dit « en plus de 12 principes fondamentaux ». Nous préférons garder la même sémantique, continuer à parler des principes directeurs. Et après la virgule, sur la même phrase, on dit « le projet de stratégie ». Il convient encore une fois d'apporter la précision, selon laquelle il s'agit du projet du plan stratégique. Donc nous pensons que ce sont des précisions importantes. Et pour le paragraphe 46, c'est la même chose. Il faut continuer à parler des 12 principes directeurs. Là, on n'a rien dit, on a tout simplement parlé des 12 principes. Voilà, Président, ce que nous suggérons au secrétariat.
I think the Secretariat will note that. Thank you very much. Any other observations on paragraphs 44 to 46? If none, we go to paragraph 47 to 52, which is essentially the implementation of the transformation agenda. Any observations? DRC again. You have the floor.
Merci, Monsieur le Président. Je suis au paragraphe 47. Il y a les guillemets qui sont placés là-bas. Je crois qu'il faut déplacer. Là où on dit les documents intitulés mise en œuvre, etc., dont l'objectif est d'accélérer la mise en œuvre de la réforme de l'OMS dans la région africaine en vue de contribuer à l'émergence de l'OMS. Alors le guillemet vient après émergence. Il faudrait déplacer cela mettre le guillemet en vue de contribuer à l'émergence. Donc le guillemet doit être placé là-bas. Et pour le paragraphe 48, à la fin, on parle du développement des synergies et la promotion du travail en collaboration. Nous suggérons de préciser la promotion du travail en collaboration intersectorielle ou avec les autres secteurs. Il faut que ça prenne tout son sens dans cette formulation-là. Merci, Monsieur le Président.
This one?
Yes, merci beaucoup la RDC pour ces deux commentaires. Je crois que concernant la deuxième, merci, nous sommes d'accord, ça sera pris en compte. En ce qui concerne la première, je crois que nous avons dans la passé écrit comme ça, donc le guillemet, ça commence là où nous parlons de l'OMS que veut le personnel et le stakeholders. Excusez-moi, je n'ai pas devant moi la version française. Nous avons dans le passé écrit ça comme ça. Donc les guillemets, si je peux dire en anglais, the quote is, we want a WHO like this. The emergence, I think, is what we are working towards. So I think we would prefer to keep the quotes where they are. The quote is what people want to see. The WHO that staff and stakeholders want.
Thank you, Adi. Any other comments on those paragraphs? 45 to 52. If none, we go to paragraphs 53 to 56. Regional strategy for the management of environmental determinants of human health. If there are no comments, we'll proceed to paragraphs 57 to 60. Global Health Sector Strategy on Sexually Transmitted Infections, 2016 to 2021. I'm so glad you have read this document so well. I notice Uganda.
Thank you, Chair. On the STIs, I did equally raise the issue of infertility and requested that WHO does consider infertility as one of the effects of untreated STIs. I see it completely missing in here.
Thank you, Uganda. Ask the Secretariat to incorporate that part. Yes, she articulated it, so let's reflect it, especially that you want it as a next agenda item for next year. Any other observations? If none, then we go to paragraph 61 to 66, Global Strategy to Eliminate Yellow Fever Epidemics. Any observations? Uganda?
Thank you, Chair. Still under 65, the following recommendations were made to WHO partners. I don't know how WHO can sensitize vaccine producers. I think the issue, what we said, request the vaccine producers to not maintain but increase the stockpiles, because that is where the problem is. If they maintain, then we shall not be able to get, for us who want to transit into mass vaccination of populations, if they maintain the current stockpiles, then we shall not be able to move with that program.
So can you just phrase the sentence?
Request vaccine producers to increase
WHO requests, because this is to WHO and partners.
Yeah, because WHO that actually that approves these companies. I think currently there are only 2 approved to provide this yellow fever, produce and provide these yellow fever vaccines.
Okay. Secretariat, have you captured that? Can you repeat that, please, Dr. Honorable Sarah Mopendi?
Request vaccine producers to increase vaccine stockpiles, not only for emergencies, but for emergencies and for mass vaccination of our populations in the yellow fever endemic belt. I don't know how.
Secretariat, have you absorbed that? Do you want to? Who is your lead person in that? Can you? Yoti, Dr. Yoti, please. Can you just reflect if you've absorbed this?
Yes, I have. I have clearly heard WHO and partners request vaccine producers to increase vaccine stockpiles. I will not go into the details of whether emergencies or mass vaccination. Thank you.
Yeah. Uganda, is that okay now?
Yes, it's fine, Chair, and it also ties in with C. I think we did not talk about only vaccination of people at the border posts. Support yellow fever endemic countries to ensure vaccination of people, not only at the border posts. This is not what we say.
But when you say so, it doesn't exclude others, does it?
Support yellow fever endemic countries to ensure vaccination of its people, and we stop there instead of talking about the border only. Because one of the things, Chair, remember what that came out of during the discussions, different member states raised issues because most times it is only travelers that actually get this vaccination, and yet that's not the case. It should really be for the endemic countries. We should look at protecting the entire population, because a single shot of yellow fever protects the people for almost life now.
Okay, I hear you. Can we hear comments from the Secretariat?
Thank you, Chair. I think that the actions of the recommendation for member states to vaccinate people is covered in number C, which talks about improving yellow fever coverage. I think this was referring to confirming the vaccination status. And Yoti, I'd like to know from you if this is correct, because it says to ensure vaccination of people. I thought at the border posts we were trying to talk about confirming the vaccination status of people, not carry out vaccination at border posts.
Yes, that's true, but we did write screen and offer vaccination. So screen means we try to confirm the vaccination status.
So can you correct the sentence? Which sentence is it now? Which paragraph, which item are you? Can you just say it, Dr. Yoti?
I'm proposing support yellow fever endemic countries to ensure vaccination of all eligible people, including screening and vaccination at border posts.
I think that's now more inclusive, isn't it? Honorable Minister, Uganda?
Chair, I think that is fine, although I think he was talking about the screening and so on, which is now missing.
No, he has included it now.
Okay.
Yes.
Okay. Thank you. I think that's fine now.
Okay. United Republic of Tanzania?
Thank you, Mr. Chairperson. We had alluded to the fake vaccination certificates as a problem in our region. I've not seen it reflected anywhere. If a word could come that could encompass all the countries of the region to ensure that certificates that are valid all the time are issued and followed after. then the vaccination and immunization will be effected as we anticipate.
United Republic of Tanzania, the issue of fake yellow fever vaccination certificates is captured in the first sentence on paragraph 63, but maybe the action to it is what you are referring to. But it actually captures it there. Can you clarify that for me?
Mr. Chairperson, we feel that an action point in that direction should be reflected because it's a challenge in this part of the world.
It included, because there are two sections there, member states and then the other one to WHO and partners.
Mr. Chairman, I think this should go to the member states.
Okay. So do you want to word it?
Could we handle that with the Secretariat in the interest of time?
Good. If you could hand it over to Secretary. Thank you very much, Eminent Secretary. Okay, any other observations on those paragraphs, or we proceed to paragraph 67 to 72, which are essentially reducing health inequities through intersectoral action on social determinants of health. Is there any comments on those paragraphs? If none, we go to paragraph 73 and to 77, which is the big issue of universal health coverage. Any observations? If none, we now go straight to paragraph 78 to 82. The Africa Regional Framework for the Implementation of the Global Strategy on Human Resources for Health. Another big one. Okay, if there are no comments from Honorable Ministers, Uganda.
Thank you, Chair. Chair, while discussing this challenge of the human resources for health, I did talk about task shifting, because as a country we have made progress in tackling the HIV challenge. We've made progress in tackling the palliative, in providing palliative care services because of this task shifting. And I did mention that. I don't see it reflected anywhere. And I thought it's an important thing that we in the African region should consider.
Thank you, Uganda. If you look on paragraph 80, and the third sentence there, on the fourth line from the top, member states indicated a need to institute mechanisms for health worker retention to mitigate brain drain, the use of task shifting, and so on and so forth.
Yes, Chair, this is for the member states, but it's also important that WHO as well, in its documents, includes this. Or is it? It's not the case? I see. Because we're adopting the WHO document and also commenting. So I thought the WHO should also consider this in their documents. It's not only for member states to take up.
Okay, regional director.
No, I think it's noted. I mean, WHO already has guidelines and tools on task shifting. Perhaps you'd like us to intensify their promotion and use in countries, but they already exist. We are working on this. Yeah.
Okay, Uganda is noted, and we hope that it will then be reflected appropriately. Any other observations before we go to paragraphs 83 to 87, regional framework for integrating essential NCD services into primary health care? Any observations? If none, then we're doing very well. Let's go to paragraphs 88 to 93, road safety. Any observations? United Republic of Tanzania?
Mr. Chairman, there was an observation that we had anticipated would have been included as a recommendation made to the WHO and partners on data for burden of disability as a result of motor traffic accidents, and it's missing. So we would have proposed the C to be data on burden of disability to be reflected.
And we suggest, Honorable Delegate, if you could send your formulation to the Secretariat. Thank you. Any other observation? If not, then we go to paragraphs 94 to 98. 94 to 98, which is authorization and oversight for clinical trials in the Africa region. It was an interesting topic. Very interesting topic. Any observations? United Republic of Tanzania? You have the floor.
Mr. Chairperson, unfortunately, I had not put down my card, so it appeared like I wanted to make a comment. For that, I apologize.
Okay. We thought that you have all the comments for, or some comments for this important one. It was an important one. Any other? Okay, if not, we go to paragraphs 99 to 102, which is on the implementation of WHO program budget 2018 to 2019. Program budget, now, this is now genuine, United Republic of Tanzania.
Mr. Chairman, we had put in a sentence to the effect that member states be given a reflection of the amount of resources that will be used to carry out research in our region, tropical disease and human reproduction. That has not been reflected anywhere in the text.
I remember you articulating that, so maybe just put up an appropriate formulation to the Secretariat. Thank you, United Republic of Tanzania. Any other comments? Now let's look at paragraph 103 on its own. Information documents. United Republic of Tanzania.
Mr. Chairman, we had requested for invoices to enhance follow-up on contributions, but that statement has not been reflected anywhere.
You are still on the budget, eh?
Yep. 103, information documents.
Or as invoices?
Yes. Because there's a sentence that says member states raised issues and challenges relating to large number of refugees hosted by several countries under the contributions of member states to APHEF. And then just stopped there and then went on something else. There was an issue that we had requested for invoices because it makes it very easy to build a case in Treasury.
Thank you very much. I think, again, just an appropriate formulation will go a long way. No further comments on that paragraph. We go on to paragraph 104, which you have already done, the place and dates of the 68th session of the Regional Committee. So we'll skip that and go to paragraphs 106 to 1112, the draft concept note on the 13th General Program of Work. Any observations? Any comments? Uganda.
Chair, sorry to take you back. I hope that 106 reflects, 105 reflects the decision that we just made, that we reviewed and approved the budget, the draft provision agenda with amendments.
Thank you for that observation. Thank you, Uganda. Any other observation? Okay. 106 to the end. 106 to 112. Any comments? Do I see anybody? Which one is this page? Well, if there are no comments, I think the job has been well done, and we move on. There are no comments. The document is adopted. Thank you. We've now reached the final part of the 67th session of the Regional Committee, agenda item 23, on the closure of the 67th session of the Regional Committee. So I would like to invite the Honorable Minister of Health of Liberia to deliver the vote of thanks.
Thank you. The Regional Committee, considering the immense efforts made by the head of state, the government and people of the Republic of Zimbabwe.
Hello.
Yes.
Sorry, Minister, can you come up to the podium so that we
come
can?
to the podium.
Yeah, this side here.
That's the podium. vote of thanks. The Regional Committee, considering the immense efforts made by the head of state, the government and people of the Republic of Zimbabwe to ensure the success of the 67th session of the WHO Regional Committee for Africa, held in ideal setting of Victoria Falls from 28 August to September 1st, 2017. Appreciating the particular warm welcome that the government and the people of the Republic of Zimbabwe extended to the delegates. First, thanks the President of the Republic of Zimbabwe, His Excellency Robert Gabriel Mugabe, for the excellent facilities provided to the delegates and for the inspiring and insightful statement he delivered at the official opening ceremony. Secondly, expresses a sincere gratitude to the government and people of the Republic of Zimbabwe for their outstanding hospitality. Thirdly, we request the Regional Director to convey this vote of thanks to the President of the Republic of Zimbabwe, His Excellency Robert Gabriel Mugabe. Thank you.
Thank you very much, Honorable Minister for Liberia, for your very kind vote of thanks. I will now ask the Regional Director to address the Regional Committee.
Dr. David Parirenyota, Chair of the 67th session of the Regional Committee and Minister of Health and Child Welfare in Zimbabwe, Honorable Ministers and Heads of Delegations, representatives of bilateral and multilateral cooperation agencies and other partners, esteemed colleagues of the WHO, esteemed colleagues of sister UN agencies, members of the media, ladies and gentlemen. First of all, let me start by wishing all our Muslim colleagues and honorable ministers Eid Mubarak. Normally, I should be at home with my husband, who is celebrating today. And I'd like to promise you that next time, we'll be on the lookout so that you spend this important holiday at home with your families in scheduling the regional committee. But really, we wish you a very joyful celebration of this important Eid Mubarak. As we come to the end of the 67th session of the Regional Committee for Africa, I'm sure you will agree with me that this busy session has gone very smoothly and positively, and thanks in no small part to the wonderfully relaxed setting here in Victoria Falls. Some days might have been grueling and very long, but I'm pleased and I'm really proud that you remained engaged throughout, and they were offset by some wonderful social activities. Again, I'd like to thank my sincere gratitude to His Excellency President Robert Gabriel Mugabe of the Republic of Zimbabwe for his presence at our opening, having traveled all the way from Harare, and also thank the government and people of Zimbabwe for so successfully hosting our regional committee. A special thanks to the Honorable Minister, Dr. David Parirenyota, for his skillful and excellent chairing of the regional committee meeting, and to the Ministers of Health of Cameroon and Côte d'Ivoire, who unfortunately have had to leave, but I'd like to convey this thanks through their colleagues who are with us for managing our work together with the Zimbabwean minister. My thanks to all of you, honorable ministers and heads of delegation, for your enthusiastic and very constructive participation in our discussions. You've taken some very important decisions during this regional committee. We've just heard about the 6 strategies and frameworks that you adopted on a number of issues which I will not enumerate. In addition, several cross-cutting issues emerged during our discussions at this regional committee. One of these is on the importance of advocacy for high-level political commitment and for its translation into increased domestic allocation for health in our countries, which will be particularly important for universal health coverage, and also to cover some areas that we acknowledged are severely underfunded, like non-communicable diseases, the issue of road traffic accidents and violence, and disabilities and rehabilitation. It'll be important for us not only to engage with our leaders, but also to use their platforms such as the African Union, the regional economic communities, to help mobilize domestic resources. We heard a lot as well about the importance of country ownership and of multi-sectoral collaboration as we take our work on health forward in many spheres. It's essential for universal health coverage and the Sustainable Development Goals. And I'd like to assure you that as a Secretariat, we will do more work to develop or refine our tools and approaches for working with other sectors, because it's emerged at this meeting how important it is across a range of health problems and themes. In this regard, and as we had promised at last year's regional committee, we launched the tool developed with member states at one of our many side events to guide you on strengthening health systems for achieving the Sustainable Development Goals. I was very encouraged to hear how a number of you are moving forward with introducing UHC. For example, Zambia is introducing a social health insurance bill and is significantly increasing domestic allocations to health. Zimbabwe has innovative plans for a national health fund through a 5-cent levy on cell phone calls and mobile data. Guinea's multi-partner compact, led by the President, has increased resources for enabling UHC, allowing 4,000 health agents to be posted in peripheral areas. And Cabo Verde has forged a strong partnership with the private sector, which is strongly involved in the country's work on the Sustainable Development Goals. At the side event on polio, we were reminded that the region can only be certified to have eradicated polio if 3 years have passed without wild poliovirus confirmation, and if our surveillance performance has been maintained at certification levels. Ladies and gentlemen, a number of countries are below surveillance at certification levels, with an entire absence of information in some. We therefore urge all member states to have oversight of polio eradication, to reinforce surveillance, and to be more vigilant as we push towards that eradication milestone. In conclusion, I kindly request the Honorable Minister of Health of Zimbabwe to convey our appreciation to His Excellency President Mugabe for the wonderful hospitality and contribution of Zimbabwe and its people for the resounding success of this meeting. We were very much aware of the very large team that were working under the leadership of Dr. Gwinji, the PS in health, to help to make this a success. So we'd like to thank him and them as well. We were lucky to be able, despite working very hard, as I said, to enjoy the unique beauty of this location, and we'd like to thank you for the extraordinary hospitality that was shown to us. I'd like to thank and acknowledge the translators, the interpreters, and the members of the media for their invaluable contribution also to the success of this event. I'm very grateful to my WHO colleagues for their hard work and perseverance in making this meeting a success. It reflects months of hard work, and I'd like to recognize especially Dr. Joseph Kabore and Raul Thomas, who steered the two pillars, if you like, the technical and the management logistics of this work, and Pamela Drame, who skillfully navigated the many aspects of this work and made sure that we continued to move forward. I'd also like to particularly acknowledge the new Director General, Dr. Tedros Ghebreyesus, for dedicating so much of his time to our Regional Committee for Africa, as we said, which was his first since he took over his position. I'd like to invite you on his behalf again to contribute further comments on the 13th General Program of Work, which is going to be a very important guidance document for our work in the years to come. We are very happy to have our dear friend Dr. Asamoah Ba, the Deputy Director General, here with us for a short time, and we were grateful for all his contributions and would like to wish him well in the future as he goes back to Ghana. My thanks to the Republic of Senegal for agreeing to host our next session, the 68th session of the RC in Dakar from the 27th to the 31st of August. As I said, we'll make sure that this date doesn't clash with any major events on anybody's calendar. Finally, I'd like to wish you all a safe journey back home, and we look very much forward to working with you in implementing the decisions that you took, the strategies that you adopted at this meeting in the coming periods. Until we meet again, I wish you all the very best, and I thank you so much for your participation in this regional committee.
Let me thank Dr. Moeti for those very important messages that you have given to us. Thank you, Dr. Moeti. The program says here, the chairperson now delivers his closing address. Let me do that. Let me recognize the honorable ministers and heads of delegations that are here. The Permanent Secretary in the Ministry of Health and Child Care, the Permanent Secretaries that are also here, the Regional Director, Dr. Moeti, and your team. Let me recognize you all. But also the partners that are here, the various partners, very lifelong partners that are here, who are always with us. The members of the media that have been with us since we came and before we came, and they're still here. And I'm sure they've interviewed quite a lot of you here. Let me also recognize the other distinguished delegates that are here. You were welcomed here by the President of the Republic of Zimbabwe, and it was really a delight for him to be here. He assured me that he absolutely enjoyed himself, and he says, yes, I spoke for longer than I thought, but seems people listened. So he seems to have been quite gratified. And thank you very much for honoring him. I will convey your messages to him. It was a great honor for Zimbabwe to host this very important meeting. Really a privilege as well for all these ministers and heads of delegations and the whole secretariat from Geneva to come here. It was a big, big honor for us. But this sort of meeting sharpens us as ministers of health and heads of delegations to be able to determine our destiny in the health delivery system for Africa. And with the leadership and technical assistance from WHO, I think that the Africa region is now poised to go far. I was particularly delighted with the quality of the discussions, the insights that came from the delegates, and also I think the suggestions that came thereof. It was a very busy program, but very relaxed at the same time, and extremely harmonious. We enjoyed ourselves, those who did, on the social events. Don't forget, when you are not here, when you come here, you can always also ask for another boat cruise, which is usually the sunset cruise, and you can take photographs when the sun is setting. And sometimes you appear like you're actually touching the sky if you do the photograph properly. And if you go to the Victoria Falls, you will not miss. It's unfortunate you were not showered. Usually there's a lot of showers that you will actually go during December, you have to carry a raincoat. Not not because of the rain, but because of the showers from the falls. So I'm really happy that a lot of you went to view the Victoria Falls and actually enjoy them. We had very interesting topics here, particularly universal health coverage, which we must now all pursue as countries. The issue of road safety, to me, is very key, and I still want to say that as soon as we go back to our countries, let's try to look at that document. It's something that we can implement. And I liked the way we looked at health financing, particularly as it relates to universal health coverage. But always the issue of human resources for health is so key. Although we've discussed these things and seemingly left out HIV and AIDS, the Africa region should never think that we should be complacent when it comes to HIV. I'm aware that last year it was discussed. I'm also aware that whatever we do, it is a common denominator that we should continue to address. So I'd like to thank Dr. Tedros, the DG, and his DDG who came here, stayed with us, and shared his very strong views, good direction he was giving, and we are very, very grateful. I think that he will do well for the Africa region and for the world, and we wish him that much wellness. Dr. Moeti, let me thank you again. You were religiously here all the time. I would see you with your handbag walking out and in, unaccompanied. It was a good thing because you were focused. Please continue that, and all your team, let me appreciate that. And the men who are sitting next to me, the legal men, I've learned quite a lot that you need a legal person always nearby. Whatever you do now, Dr. Gwinji, some lawyer always nearby, and they'll make sure that you are panel beaten appropriately. I want to thank my own team, led by Dr. Gwinji. We came with a huge delegation, but most of them were really on the ground doing some work. So I would like to thank you very, very much. And my deputy minister was leading my delegation here. Mr. Msiwa, thank you very much for coming. But also, like I said, the media, it was good to have you here. So I will convey the sentiments from this meeting to His Excellency, the President of the Republic of Zimbabwe, President R.G. Mugabe. And with those few words, I would like to declare that this particular regional committee, 67th Regional Committee of the WHO Africa region, is officially closed. I thank you. Now that we have closed, I know that you still want to continue, but it's closed. Thank you very much.
Congratulations, sir.
Thank you.
Masterfully chaired.
Thank you. Thank you. We're supposed to.
It might seem crazy what I'm about to say.